Okay, chapter 20 from Marriage and Family Systems, Measuring Family Competence, the Beavers Model, Robert Beavers. What makes a family normal? How do we function? What spectrum do we look at? How do we view families from a systemic perspective and approach? The Beavers Model, particularly the self-report family inventory, which is derived from the Beavers Model, has extremely high validity and reliability. It also provides a type of map. The scales that are central to the Beavers Model are family functioning. How well can we observe families? It takes precedence over symptoms or typology. So clinical typology, schizophrenic, addictive, codependent, is not very clinically useful when you're looking at family strengths and vulnerabilities. Beavers does not adapt with that. Family competence. Are we functional or dysfunctional, and how? Families at similar competency level have different functional and behavioral styles of relating and interacting with each other. The most competent families are able to shift their functional style as developmental changes occur. The most dysfunctional families show marked rigidity in functional style. Family assessment is the perception of family events from at least two sources: the observer, who's the therapist, and a family member who's an insider. Competency in small tasks, discussing issues or resolving conflicts, is related to larger areas of living, raising children, maintaining families, and managing the family. Family competence and style is what the Beavers Model emphasizes: how well a family as an interactional unit performs necessary nurturing tasks, daily tasks of organizing and managing itself. Highly related to competence is the development of confidence and self-esteem in individual family members. Trust, clear communication, direct communication, the ability to resolve or accept differences. Some differences cannot be resolved, so there is a toleration level. What can be accepted? When assessed observationally, it's measured using the Beavers interactional competency scale. And it looks again at degrees of centripetal, CP, or centrifugal, CF, qualities in family. Centripetal families seek satisfaction from within the family. Children are much slower to leave home. Homeschooling their children, believing the homeschool experience is superior to the public school systems. Centrifugal families look for satisfaction in the outside world. Children leave home earlier than the developmental norm. So I think that's an interesting concept. It also means, just to let you guys know for future reference, the Circumplex Model, the Beavers Model, the McMaster's Model are all on the the AAMFT testing, the clinical testing for licensure. Not used as much, but certainly on the test. So if you're looking at centripetal families, they hold their children very close. They try to repress, suppress, deny negative or hostile feelings. They plant positive ones. Centrifugal families are not always as affectionate. They're more comfortable with negative or angry feelings that kind of force outward movement. Extremely centripetal families bind their children, make emancipation difficult. Extremely centrifugal families expel their children before individuation is complete. They're prematurely expelled and quite often return back home as adult children needing help. And this book still is looking at DSM-3 versus DSM-5. That's somewhat of a problem, so in your reading, adjust what you know to be clinically competent accordingly. The self-report family inventory is found in a book that you can find on Amazon called Measure of Clinical Scales, and it gives a competence score for each member, a cohesion score for each member, and an estimate of family style, addressing closeness, togetherness, tendency to enjoy time and activities together, major family themes related to style from both an insider and outsider perspective. Regardless of whether the assessment procedure utilizes observational instruments, self-report scales, or both, Understanding the dimensions of competency and style provide a useful map for identifying levels of family health or dysfunction. They look at, the subscales look at things like overt power, parental coalitions, closeness, mythology. What's the story of our family? Permeability, the boundaries. Goal-directed negotiation, clarity of expression, responsibility, range of feelings, mood and tone, unresolvable conflict, and empathy. The style subscales include dependency need, overt and covert conflicts, physical spacing, concerns and lack of concerns of appearance to the outside world, profession of closeness, degree of assertiveness versus aggressiveness, and the ease of expression of either positive or negative feelings. They give you some figures on page 555 to look at poor boundaries, shifting boundaries, clear communication, clear boundaries, and capable negotiation, including warmth, respect, intimacy, and humor. The relatively clear boundaries sometimes trigger distancing, anger, anxiety, depression, ambivalence. Some periods of warmth and sharing interspersed with control struggles. The very poor and shifting boundaries fluctuate from poor to rigid, distancing, depression, outburst of rage, lack of shared attentional focus, stereotype family process, despair, cynicism, and denial of ambivalence. So you're going from very troubled families to families in some type of situational distress to families that are able to function fairly well. Clinically useful groupings of families, systems orientation, optimal families are families that understand that conflict is inevitable. It's not evidence of dysfunction, but they're very close, very connected, and interested in resolving those things. If an incident happens accidentally, there's no motive attached to it, they have no score to settle, and they quickly attempt to come back. Those families are characterized by clear boundaries, contextual clarity, understanding who the comments are addressed to, relatively equal power, intimacy, the power of a loving relationship, the experience of closeness without coercion, internal locus of control for each person, fairly autonomous. They take responsibility for their own thoughts, their own actions, their feelings. There's a tolerance of uncertainty, ambivalence, and imperfection that allows family members to be honest, mutual trust, not with lying being unnecessary, joy and comfort in relating to each other, and skilled negotiation tasks. Typically, they share significant transcendent spiritual values and belief systems. Most of these families do well. Any family, even an optimal family, can fall in their functioning level with divorce, with death, with chronic illness, or any of these other types of things that have not been studied as well in families that are functioning better. Adequate families, relatively effective, relatively competent, relatively clear boundaries with intimacy and individual responsibility encouraged. The next section is mid-range family. It's the group that is most populated, it's most normal in sense of being average. Both parents and children can be diagnosed with certain types of mental health disorders. Boundary problems are most evident with some family members trying to control others' thoughts and feelings. So a great deal of stereotypes, mixed messages, mixed feelings about themselves and others. Mid-range centripetal families have great concern for rules and authority. Authoritarianism is successful in controlling the impulses of other family members. Mid-range centrifugal families try to control by authority and intimidation, but they find over time that control is fairly ineffective. Mid-range mixed families alternate back and forth between centripetal and centrifugal behavior, reduces the rigidity of the more extreme style, but it also increases inconsistency and uncertainty in the families because there's no clear message. Looking at borderline families, centripetal borderline families control more effectively than the centrifugal families do, but both have near exclusion of concerns with joy, satisfaction, or intimacy. Very little emotional support for the family. Developmental tasks are very difficult to accomplish. Resolution of ambivalence or conflict is very difficult. A lot of these families are very chaotic. Centripetal borderline families they're very difficult for therapists because of the degree of chaos, the degree of compulsivity and ambivalence. Borderline centrifugal families are more open to work with for therapy than centripetal families. There's a great deal of anger, a great deal of frequent direct verbal assaults, a lot of no man's land, places that we cannot even talk about. Severely dysfunctional families are the most limited in negotiating conflicts and adapting to developmental demands and situational crises. Any of these families that pass the average family, when conflict hits or transitional lifestyle situational stress hits, those families tend to blow up. They deny the passage of time. They don't have implications in place for growth, development, aging, and death. Their behavior and feelings are unresponsive to changing abilities of families. They have very little glue to hold them together. Very difficult for them to individuate and find a sense of self-identity. Severely dysfunctional centripetal families have a tough, nearly impermeable outer boundary. Quite inhibited, over-controlled children, a great deal of pressure not to separate from the family unit. Severely dysfunctional centrifugal families, extremely diffuse boundaries. Family organization unstable, children run away, parents leave, a lot of neediness and hostility within the family members. The family may produce sociopathic, which is an older term. Maybe a better term might be antisocial offspring with antisocial personalities, with total lack of empathy. Practical use and research. Those are families that are going to be found in DFACS and in the juvenile justice system. And any of the other families can find themselves, but those families kind of live there. They're going to be there. So you're looking at cumulative 16-year experiences with different families. At the Dallas Clinic, there's a great deal of validity and reliability in the findings. So this is something that, again, I don't know that I would necessarily advise this to be used specifically in all of your work. It certainly can be a corollary, but I think understanding it and understanding the kind of families and recognizing, oh, according to Beavers, this is the kind of family maybe I'm facing, will drive your theoretical orientation, your treatment interventions, your goal setting, your collaborative treatment planning. Looking at page 577, the self-report inventory is there. It's very small, but it is there for you to look at and try to determine how they see themselves. There's also a grading scale on page 580 for competency, cohesion, conflict, leadership, and expressiveness to help you understand. The next model we will look at is the McMaster's model.